First of all, I would like to thank our management of ES College of Nursing and also Principal Ma'am, Mrs. Pochelvi Ma'am, and also Soumya also for giving me the opportunity. Actually, when they called me, that time I was very busy with one conference actually. She called me by the evening, she told the one career opportunities in nursing. I thought it is a conference. I don't know whether it is a seminar. So I thought I had some other program in next, I think last week I went to Kolkata for one conference. So madam, I'll tell you after that, then after that she told you have to come and give your date. After that also I didn't realize that I am going to take you people. I thought it is a nursing conference, we will be taking the only half an hour for that. And after that I came from the Calcutta, then she told that I asked what is a target audience. Then only she told only the students. So I was very happy that I'm going to tell the opportunities to my future pillars. Understand? So you will be the future pillars of nursing, right? Okay. So I am very happy to share my opportunity, my experiences and whatever I learned from my seniors and what I learned now. I'm learning. Nursing is a learning. It is not a stopping thing. Okay. Suppose if you are doing some other professions, you'll get a job, then you'll be settled in your life. Nursing is not like that. It is like a learning. All medical profession is, I think it is a learning process. There is an endless process. Okay. So what we need is we have some interest to learn. That is the thing. And also you should know what is the thing. Now that only I am going to tell you what are the opportunities we have after the B.Sc nursing. It is not only in the nursing field we can shine, and other department also we can shine. In the medical field and the coding and everything, so many opportunities are there now. When we finished, I think we have finished in 94 to 98 batch in Sri Ramakrishna College of Nursing, Coimbatore. So that time I didn't know, when I joined the B.Sc nursing, I didn't know what is nursing. You won't believe, right? Yes, just like that I finished 12th and I joined, then I was waiting for the medical seat. I couldn't get the medical seat, so next option is nursing. I don't know what is nursing, what is B.Sc nursing. That time the diploma nursing is very this thing. The B.Sc nursing was a new, so we don't know. Then that time somebody told it is equal to doctor. That time we believed everything. Okay, when you enter into the hospital only, they know our madam will come do bed making. What you will think? So everybody was telling that it is like a doctor, why should I do the bed making? You cut nail cutting, sponge bathing. After that only we realized that, so nursing is a very important. You should say, you are proud to say you are the nurse. Still I am very proud to say I am a nurse. Okay. So after that nursing, then I got a job there in the own institute. 2 years I was working in a cardiology nurse. Then I went to the, just I wanted to see how the College of Nursing, how everybody will have, no, our tutors are coming with daily one saree, different saree, right? So our madam will come cotton sarees. We used to admire them. So like that also we have to do one day. So 2 years I was working in the College of Nursing as assistant lecturer. Then after that marriage and everything next came. So I came to Pondicherry. I was working in PIMS cardiothoracic ICU. There we did everything. So at that time only I realized how we important to the patients. So they allowed all, I used to intubate, I used to do ICD training, I used to change the drugs. So if you have the confidence, you can do it the bedside. Whatever you want, you can do. There is no restriction. Then accidentally some boy in our class 4 workers will be there. No. See, he gave me one paper, newspaper one day. He told some JIPMER they have called for recruitment. Just we applied. For our like a private college, what they will think? No. So in private college, they'll think if you study in a private college, you'll go to the private college, private hospital. If you study in the government hospital, you will get a government, like that. So they told you can government college. No, we thought we don't want to go to the government college. So we are not interested in the government setup. So I applied for the JIPMER. At that time only nearly 800 people we wrote, 400 people came, nearly 100 people like selected. It was very tough. JIPMER exam is very tough, and after that they will conduct a skill test, everything, then only we enter into that. Then the 6th pay, 7th pay came. That time my salary was only 15,000. When I joined in JIPMER, my salary is 15,000. After 2 to 3 years, that 6th pay, 7th pay came. So that time my salary increased to 25,000. I was shocked. Really, when you got 1,500 rupees in a first salary, suddenly within a 2 to 3 years, you got 25,000, no? So I was shocked. So after that only all the people got awareness that JIPMER, you have to go to the JIPMER, AIIMS. That time only everybody knows. So the competition is become very, very more that time. Understood? So after that only 7th pay it came. Now my senior nursing officer salary is 1.5 lakhs in JIPMER. Okay. And last month some of the people joined, all young chaps from our students only. I am very happy to see that all young people from College of Nursing, JIPMER and Tamil Nadu College, so many colleges, all the students came and joined. Their basic salary is now 80,000. Okay. So please you try to read. I wanted to tell you people, because நம்ம படிக்கும்போது என்ன பண்ணுவோம், just we'll see the theory, we'll go to the patient, நம்ம மேடம் என்ன சொல்கிறாங்களோ அதை பண்ணிட்டு வந்துடுவோம். It is not like that. I found out when I attend the competitive exam, I was working in a PIMS, no, that time I was in CTVS. So the same questions they were asked in the interview. So whatever I did to the patient, I am able to explain that one that time. So it was very helpful. So whenever you are going near to the patient, suppose if you are going and see the hypertensive patient, just to see, compare the book picture and patient picture. Then you won't forget in your life. Whenever they are asking questions, you won't forget. In case if you are working in a CLR, if the baby is having, baby is very sedated, baby is not able to, because that reason is they have given a morphine to the mother, the baby will be silent, not crying. So immediately they will give the antidote. So that antidote they will ask in your competitive exam. So you can easily, you can tell. Okay. Suppose if you are working in a cardiology ICU, if the patient is having a ECG changes, why there is a tall T wave, you should know there is a potassium is high. So the patient is having a tall T wave. So you can easily tell the answer to the interview, in the interview. It is not that you have to go and read somewhere like that. By experience you can explain, you can attend the interview everywhere. Understood? Then if you are working in ICU, you should have a skill to manage. So you should have the skill, like if you are using the defibrillator, right? So you should know how to give the shock. It is not that I know the defibrillator, the doctor will give. Now the trend is, I am very sorry to say, our nursing officers, everybody is coming and joining, they are not at all talking to the patient, they are not touching the patient. Okay, they are thinking that anyway we got the job, monthly we are getting the salary. It is not like that. You have to talk with the patient, you have to touch the patient, you have to do all the procedures. You should not compare with the doctors. They are doctors, right? So now they are thinking everybody is in equal age group, they are thinking that we both are equal. Why should I do? If the patient, anybody is having a ventilator, if the patient is on ventilator, suction we can do. We are reading, no? We are doing suction, right? We are doing assignment, right? Suctioning. You are putting Venflon, right? That is our work. We are giving all the work to the resident. No, that should not be there. I am fighting with the doctors. Our nursing officer will come and tell, why should we do, sister? That is their work. Even checking the blood glucose level is not work nowadays. It should not be there. Actually, I wanted to tell you all those things because this nursing is totally changed. You know, when we were working there, that time one sister, she will allow the student nurse and she will go to the lunch. We will take care of the whole wards. But nowadays, that I mean the private hospital, and the doctors you should not touch the chart, you should not touch the patient, like that they will tell. Whatever you want to give, you can give with the supervision of the seniors. Is it like that only? No, if you go to the private hospital, they won't allow the nursing students to give the injections, right? Only the government hospital only they will allow, because there is a shortage. There is a shortage of nurses. So அங்கே வந்து என்ன பண்ணுவாங்க, சிஸ்டருக்கு வந்து ஒரு இன்ஜெக்ஷன் கொடுத்தாலே அவங்களுக்கு போதும். Nearly 40 patients, 50 patients will be there. So if you give one blood sugar for all the patients, she will be happy. But in our private hospital, they won't allow us. So where is the skill is going now? So you have to be confident in your work. Please do the work. Don't compare with the doctors. Whatever you are learning in the B.Sc curriculum, please apply in the clinical areas. Just I wanted to tell you that one. All the best. Thank you once again.